So we're going to continue with some practice of using our advocacy inquiry model of debriefing. One really important thing, so we talked about the basic assumption that everybody participating in our work or our learning activities is intelligent, capable, cares about doing their best, and wants to improve. And that comes from the Center for Medical Simulation in Boston, Massachusetts. Really kind of some key thinkers about the psychology of learning in high-performing teams and simulation and patient safety, and also some really good evidence-based practices around debriefing. So another key component is the ladder of inference, because as human beings, we take information that's coming in and we apply meaning to it, and it also has our lived experiences associated with it. And sometimes we can fall into the gap of making wrong assumptions and stereotypes and categories that are untrue. And so we say a lot, don't go up the ladder when we're having difficult conversations or difficult situations, or trying to educate and facilitate. Instead, you need to stay at the bottom rung of the ladder and think about observable data and experiences as if there was a video recorder and we need to caption it. So observable data is where we need to stay. Your observable information. Rather than selecting, adding meaning, making assumptions, drawing conclusions, adopting beliefs, and taking actions. Again, we're human. This is how we survive. This is how we learn. But that's part of this reflective loop of why it's also really important to be reflective practitioners, because we want to always challenge some of our beliefs and assumptions so that we can grow. And so as a facilitator, this is a really important thing to remember, is that we stay at the bottom of the ladder of inference. For example, on the right, let's say you take some observable data. One community member is looking at their phone and not contributing to the meeting that you're in together. So then you add meaning. This person doesn't want to contribute and they don't care. And then you make assumptions. Well, if people don't care, they shouldn't be invited to future meetings. And then the action is, I'm not going to invite them to any more meetings because they're not contributing. And so going up the ladder because of observable data and applying the wrong meaning or assumptions to that, we could lose a really critical member of our team, right? And so assuming positive intent to begin with and exploring more before making assumptions and taking incorrect actions can really cause us to have better communication overall. And I do think that leads to more high-performing teams, but it also leads to a safe environment where, maybe this person had something going on with their family, like maybe that's a really healthy work environment where someone can take care of their family needs, but still be invited to the next meeting, right? So not as immediately adding meaning and jumping to assumptions, unless later on we find out those assumptions were to be true, but 80 times out of 100, that's not the case. So staying at the bottom of the ladder when you're facilitating is really key. Observable data and actions is where we need to stay when we're facilitating conversations around actions and frames. So let's talk a little bit more about debriefing with good judgment, which includes the advocacy inquiry model. And this comes from Jenny Rudolph and Simon Dufresne and Dan Raymer. I know and follow Dr. Rudolph and Dr. Raymer the most out of this core group, out of the Center for Medical Simulation. And they really came up with this debriefing with good judgment methodology and theory. And they've been working on this for a long time. They have a lot of excellent resources on their website. They have an excellent series of podcasts as well that really helps you continue to dive into this information in addition to their journal articles. They also have a lot of really great training opportunities for interdisciplinary teams. So this method consists of 3 elements. First is it focuses on creating context for learners or teams. It moves the focus to actions, and then frames, and really exploring those frames based on the actions and observable data. And then potentially exploring assumptions and knowledge with the ultimate goal of coming out with some different frames and maybe some improved ways of doing things. And then the instructor's view, in this case of simulation, is shared to initiate the dialogue with participants. This approach is designed for instructors to critically evaluate learners while maintaining a trusting relationship. So it's being respectful of our interdisciplinary colleagues, professionals, adult learners. So again, it's set up with frames, actions, and results. And our goal is through our debriefing methodology to change later actions and lead to new frames of thinking. Here's an example. The frame is, I must have a pulse ox to know how my patient is breathing. An action would be frantic search for the pulse ox, while the patient result is they desaturate and they become more and more hypoxic. An alternative frame is that we would want someone to leave with after an experience like this is there are more reliable ways to assess breathing than a pulse ox, like chest rise, lung auscultation, patient's overall circumoral hypoxia, mucous membranes. And the action would be, if we can't find the missing pulse ox piece of equipment, let's go back to our assessment of the respiratory system and take actions based on that. And then the result, and if we replayed that situation, is recognition of no chest rise, no breath sounds, start, support, rescue, ventilation, calling for help, etc. So through having an experience where we didn't have the right equipment and we missed key things about the patient to take actions on, we're not only changing the frame around someone in a respiratory distress, but also in other situations where maybe the right piece of equipment isn't available. How do we critically think and go to alternative ways of managing the situation, making judgments, taking actions? And so really you're doing something specific to respiratory distress, which evokes that emotion, which opens the mind to thinking differently, and then hopefully you'll change their actions later on, but also change their frame and come up with some different transferable skills around critical thinking and clinical judgment and taking action in the future. So this is the formula. This is the advocacy inquiry formula, which we refer to as PAIL, and again, coming from Center for Medical Simulation. First is previewing and setting the stage as the facilitator. You'll notice in this formula there's a lot of I words, not you. So it's all about being curious, not punitively judgmental. Okay, so we didn't say no judgment, we said using good judgment. So we set the stage with observable actions. In this case, it is a simulation. I would like to talk about the moment in the simulation when. Or if I'm in a clinical setting, I would like to talk about the moment in the patient's room when. Okay, so we're setting the stage. And then the first part is observation. That's advocacy 1. I saw, I noticed. Okay, so again, the observable, the situation, the observable action that you saw. Part 2 is talking again about advocacy. What's the reasoning or concern why you're bringing it up? I think it seemed to me I'm concerned because. And then the inquiry. So I'm curious, or I wonder, how did you see it? Opening, you've set the stage, you want to talk about a specific situation, and you haven't used assumption or went up the ladder as you're making these statements. I will say that is the hardest part, because sometimes we'll say things like, you looked very concerned, or you were in a lot of distress. And then your participant is thinking about, my face really looks like that, instead of the objective data that you need to say instead, right? So we're not applying meaning or assumptions. We're trying to stay at that bottom of the ladder, observable information and data and actions. And so you set the stage, you clearly state your observation, you clearly state why you brought it up, and then you invite the participant to share what they were thinking. You're encouraging them to reflect, be open to sharing the why behind their actions and what they were thinking. And then listening is so important to understand the frames behind the observed action. So let's look at a couple of examples, okay? Kind of going back to our initial respiratory distress situation. So your observation, I noticed that you stepped away from the patient to look for the pulse oximeter. Your advocacy, and it seemed to me that there were alternative means to assess the respiratory status. And the question, I was wondering what your thoughts were at that time. So judgmental would be, I was shocked that you walked away to look for a pulse oximeter for 90 seconds while the patient desaturated, right? I feel like that was my whole lived experience in nursing school, but that's just me. So non-judgmental or good judgment. So what was the patient's saturation when you looked for the pulsometer? You know, that's guess what I'm thinking. I feel like I had just as much of that in my training as well, okay? The participant's not quite sure where you're going. But at the top, you're really clear. I noticed that you stepped away from the patient to look for the pulse oximeter. That's a clear observation, a clear stated action. And it seemed to me there were alternative ways to assess the respiratory status. I'm not making it a mystery of what I'm thinking. I'm really clear that in that moment, maybe instead of worrying about the equipment, we should be looking at the patient. And then opening it up for discussion and reflective thinking, okay? So the top is really using good judgment, using advocacy and inquiry to really uncover the situation and hopefully open someone up to thinking differently about a particular situation, an emergency like this. So again, judgmental, very accusatory. I was shocked because you, and then non-judgmental, but guess what I'm thinking? When you stepped away, what were the patient's saturations? Okay. Here's another example. I heard you say, let's not call a code. I was concerned that the patient was deteriorating rather quickly. Help me understand why you decided that, okay? So again, in these simulated situations, trying to explore and understand the frame and the patient's and the learner or participant's decision making. Judgmental would be, I really would have called a code at that point. I'm not sure why you hesitated, okay? That's closing someone down. That is not going to open someone up to thinking differently about the situation next time. And it's not a supportive environment. And the non-judgmental sandwich approach, which we've all learned in different realms of say something nice, say something critical, say something nice. Instead, you're not really honing in on the objective piece of information that you really want to talk about and maybe change someone's frame about. So I really liked how you delegated critical tasks. Next time, it might be beneficial to get more help in the room by calling a code. But I like how you took charge. The sandwich approach is mysterious as well. Okay, being completely non-judgmental leaves the person wondering or missing the point, potentially, rather than clear, objective point in the situation that you want to debrief about. Clear rationale of your concerns and why that might be not be the best trajectory for patient safety and good outcomes, or the safety of your team. And then opening up for discussion, because we've all been there. None of us are perfect. So here's the frame and some other dialogue that you might use, again, for advocacy inquiry. I noticed that. And if it's under a positive, I liked how, and giving rationale of why. How did you see it, right? And sometimes we're going to use that for the person that actually did a really great job, but is hypercritical of themselves when you do your initial emotional reaction and venting part. And so that is definitely going to be a time where we want to point out you did use best practice, and that did go well. Because sometimes you need to build up that confidence of your participants as well. You know, I saw that. It seemed to me, again, I'm using a lot of I statements. I was wondering what your thoughts are. Does anyone else have a thought? Opening it up for conversation. I heard you say, right again, clear, objective data. I was concerned that. Help me understand how you decided that. I got the impression that. It seemed to me, and I'm curious how you felt. Maybe we need to explore feelings a little bit more in that situation and how that it might have been a barrier to action and appropriate actions. Is there anything you would do differently next time? So this PALE model of advocacy inquiry is super helpful to have a strategic, structured approach to facilitating real life situations that need to be debriefed in the moment, as well as in training and learning situations in more of a safe simulation setting. But we need to try and create a safe space of respect for our colleagues anywhere we are having these critical conversations. So I'm going to leave with some tips and some references. Use short open-ended questions. Exploratory statements like "I'm curious how you see it" are so important and so much more inviting than like judgmental statements of "I would have never done that." What was happening at that point? How did you experience that? I wonder. I love that statement. I hear that one used a lot in our training settings. And you want to provide both individual and team-oriented feedback. And also, if there's someone individually you need to follow up with, definitely do that outside of this situation. And then reflection back to the group, key takeaways, really key. Silence as the facilitator is golden. Okay, you want to prompt, you want to structure, but you do not want to dominate the discussion. You do not want to lecture. This is not a teaching session. This is not passive, giving of information. This is supposed to be active learning to help people self-reflect, understand, potentially change actions and frames for the future to improve high-efficiency teams, communication, specific skills, adopt new guidelines and best practices. This is how I ended up getting into and getting formal training on debriefing, was because I would come to my post-conferences, to when I was an advanced practice nurse, my clinical meetings, practice meetings. I would come to the simulation center with my students, and I would try to lecture and coach and teach. And I was totally shutting everybody else down, to the point that I was asked by my wonderful colleagues to stop coming to those situations until I got this training. And that was some of the best advice I've gotten in my career, because it has been so game-changing for me to not feel like I've got to have all the answers, but instead, as a good facilitator and coach, and like I've seen in many preceptors over the years, being curious, being open, creating a safe learning environment really does improve someone's overall trajectory as an individual and as a team. We've all seen those people, and it's not always natural. They have learned and trained in this skill set, and it really is a game changer for your teams. So here are some great resources on debriefing, and a lot of it does come out of simulation centers, but I want to highly encourage you to use this methodology and structure of advocacy inquiry outside of the lab and take it on the road, because it is so, so important for different conversations that you're facilitating. Thank you very much. I hope you enjoyed this 2 parts of an overview of debriefing, as well as some practice with advocacy inquiry as a structured debriefing model. Thank you so much.